For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good morning and Happy New Year. My name is Hillary Armstrong and I'm a Public Information Officer with the County of Santa Clara. We're here today to provide you with updates on the continuing rollout of the COVID-19 vaccines in our county, an update on the capacity situation in our hospitals, and a reminder to all community members to please stay safe and not gather over the New Year's holiday weekend. Today I am joined by Dr. Marty Fensterscheib, the COVID-19 Testing and Vaccine Officer for the County of Santa Clara, followed by Dr. Ahmad Kamal, the Director of Healthcare Systems Preparedness, and Dr. Marco Randazzo, an emergency room physician with O'Connor Hospital and St. Louis Regional Hospital, who will speak to the experiences of frontline healthcare providers treating COVID-19 patients. Following our English statements and question and answer, we will be providing statements from the podium in Spanish, Vietnamese, and Chinese. Thank you very much, and with that, I will turn it over to Dr. Fensterscheib.
Thank you all, and good morning. I wanted to give you an update on what I think is somewhat of a light at the end of the tunnel for us, some hope in the coming year as we begin receiving additional vaccines for our county. We, to date, have received about 95,000 doses of both Pfizer, a mixture of both Pfizer and the Moderna vaccine into our county. We are following strictly the CDC's guidance for prioritization of giving this vaccine in phases. So currently we are in phase 1A. And phase 1A is vaccine going to all of healthcare personnel in our community. And that's about 140,000 people as we estimate. The other entity in phase 1A are residents of long-term care facilities. So that's happening because, again, the residents in long-term care facilities are at highest risk. They only represent 5% of our cases, but they represent 45% of the deaths that we have seen from COVID. I just got off a call with our provider task force to update them on the amount of vaccine that we will be receiving in subsequent days and weeks. They've already been receiving the first few allocations, the first 3 allocations of the Pfizer vaccine and the first 2 allocations of the Moderna vaccine. So we are moving quickly towards getting everyone in the hospital sector vaccinated. And we will then move on to additional tiers within that first phase that will take in those people that are working in the community, in community clinics, in private doctors' offices, as well as other ancillary type of workers, and will include also dentists and other medical providers in the community. So we want to basically address all of the needs of our healthcare personnel in our community, as well as residents of long-term care. The residents of long-term care are being vaccinated through a federal program that was set up in all states that is working with the retail pharmacies. So retail pharmacies like our CVS and our Walgreens are contracted with the federal government and receiving vaccine through the state of California to then go to our residents of our long-term care facilities, our nursing homes, and vaccinating those people. Also mention that we started our first vaccinations on the 17th of December, and we will be moving towards the next allocation next week to provide the second dose of Pfizer vaccine. So everything we've been doing so far is the first dose, and now some people will be receiving the second dose as early as the middle of next week. So we're very, very happy about that. As the vaccines come in on a weekly basis, we'll be able to again complete that phase 1A, and then we will be moving to phase 1B and 1C and phase 2. That will take us several months. People are certainly asking, when is it my turn? Phase 1B, again, after we finish the healthcare personnel, we will move to phase 1B. And that includes people over the age of 75, and then it will include some of the essential frontline workers, such as teachers, such as law enforcement, and such as people working in places like grocery stores. In phase 1C, we will then expand the vaccinations again to include people who are between 64 and 74, and all those people between 16 and 64 that have any chronic conditions, and again, the rest of the essential workers. So then, then after that, the last phase, phase 2, will be everybody else. Pretty much all the people from 16 to 64 that are otherwise very healthy and don't fit into any of the other categories. So it will take us, the question is how long will it take you to get through those phases? When will we get to 1B? When will we get to 1C? It depends on how quickly we get the vaccines. We are working with the community to get providers all vaccinated so that they can then take vaccine and vaccinate all of you out there as your turn comes. So we want people to still be patient. Realize also, as we're vaccinating people, you still need to wear your mask and you still need to follow all of the social distancing requirements. Having some people vaccinated in our community is not a pass to start taking off our masks and acting as though the virus is under control. It won't be under control until we have a high level of herd immunity, meaning up to 80% or more of our community is vaccinated before we feel safe enough to begin thinking about removing our masks. So stay vigilant, everyone. Your turn will come, and we'll keep you updated as we move forward. And a very happy New Year. Please stay safe. Don't gather, and stay home and enjoy your family during this holiday, New Year's celebrations, and we'll see you next year. And we want all of you to be around next year to celebrate with us. So thank you. I'm going to turn this over to Dr. Kamal.
Thank you and good morning. Our hospital systems remain stretched to the limit on this New Year's Eve. As of yesterday, we had 28 available ICU beds, which represents 8% of total capacity. In addition, there are on any given day more than 50 to 60 patients waiting in emergency rooms for a bed. This has been the state of the pandemic for the last several weeks, and it is showing no signs of letting up. In terms of total cases, we are still at 50 or more cases per 100,000 people every single day. To put that into perspective, the threshold to get out of the purple tier is a case rate of less than 7. The day before Halloween, our case rate in Santa Clara County was 4.5. We are now at 50. What we are seeing now is not normal. It is an order of magnitude more than we saw just 2 months ago. We clearly are not out of the woods. We are in the thick of the woods, and we all need to redouble our efforts. 6 days after Christmas, we are still in the state. But the good news, if there's any to be had, is that the additional pressure that was put on after Christmas was not as great as we saw after Thanksgiving. This shows that actions matter and decisions matter. While it may seem futile, given how many cases we are and how prevalent COVID is in our community, we know that our decisions and our actions drive the curve of this pandemic. We know that from last spring, when we were able to crush this curve, and we still have it within our power. It is the summation of our individual and collective decisions and actions that decide where this pandemic goes. We have in our power the ability to move this curve to a place where all of our community is safe. And I would like to thank everybody who sacrificed and made the responsible decision over Christmas to not gather and to keep their friends and family safe from this pandemic. We are now faced with yet another major holiday, New Year's Eve. And like many people, I will be very happy to see this year behind us. However, we know that New Year's Eve is a time of gathering, and we are asking once again to exercise your power to control this pandemic. Our actions matter. Our actions drive this pandemic up or down, and we have it in our control to help prevent a further surge on the healthcare system, which will drive it to the brink and potentially will make it impossible for any of us to seek medical care when we need it. That's not the future we need, and that's not the future we want. Especially to young people who may feel they're at low risk, I implore you, even if you are at low risk, you are still going to transmit the virus. And this chain of transmission will strain the healthcare system to the point where it cannot handle anybody. It's not just COVID, it's everybody, it's all of us. Please have a very happy New Year. There will be time to celebrate. There will be time to gather. It's not now. And as Dr. Marty said, there is hope on the horizon. And let's all work together and hunker down once more so we can all reach that hopeful future together. And to give a scene from the front line, I'd like to turn it over to Dr. Rendazzo from the emergency room.
Good morning, and thank you. I just wanted to provide a brief perspective from the emergency department. As emergency healthcare workers, we take pride in our dedication and obligation to help every patient that seeks care. We do so with the understanding that our line of work can come at great personal risk for ourselves and even our families. However, the COVID-19 pandemic has presented challenges and risks to healthcare workers that go far beyond the norm. Currently, we are caring for ICU patients in the emergency department because our ICUs are full. Often, the only time we can move a patient to the ICU is when a COVID patient has died. This means that if you are coming to the emergency department for an acute non-COVID related emergency, you may experience significant delays in care because we simply don't have the room. Our resources are stretched thin, and healthcare workers are continually being exposed and becoming infected as they care for your loved ones. Despite these conditions, we continue to come to work every day to do our part for our communities, friends, and families. We ask that everyone do their part by staying at home with their own households for the New Year celebration. This is one celebration you will miss for a lifetime of experiences yet to come. By staying home, you are giving your loved ones and healthcare workers a fighting chance. By staying home, you will save lives. Let's do our part. We are. Stand with us. Thank you again, and hoping for a better new year.
We'll now open up for questions in English. We'll start with NBC.
Thank you. Just a question. We've heard from other counties and even states, countries, that the percentage of vaccines going to actual shots have been low. Is there any way of knowing in Santa Clara County the percentage of vaccines that we've received that have actually been used or are going to be used?
Right. The question about, getting vaccine is one thing. How many vaccines are getting into arms? That's our absolute number one priority. And hospitals have done a great job getting those vaccines into arms, so almost all of them are done. But we have that very large group in the next tier of people in the community, not in hospitals and community clinics. And we are really going to accelerate all of our clinics and make those available in the next coming days, so that we, again, our priority, getting every single dose into somebody's arm. We do not want to sit on any vaccine like we've heard in other communities. We want to be a community that gets the vaccine and gets it out as soon as we can. And that's what we're working on.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.